Sternal bands form in the mesoderm. These bilateral bands migrate toward the center of the chest. This prepares for fusion.
Around the 7th week, the sternal bands begin to fuse. This fusion starts at the cranial end and works down. By week 10, the collagenous model is complete. The lowest segment forms the primitive Xiphoid process.
At birth, the xiphoid process is an entirely soft, flexible structure made of hyaline cartilage. It functions as a critical connection point for important muscles. During late adolescence and early adulthood, the xiphoid process undergoes fusion with the body of the sternum. This joint connects to the sternal body through a fiber.
Complete ossification typically occurs after age 40. The xiphoid process fully fuses with the breastbone.
Variations of the xiphoid process are common. Due to incomplete fusion, it may appear bifid, leaving it fork-shaped at the lower tip, or perforated with a hole in the middle.
Never press on the xiphoid process. Trace the ribs up to the notch. Place 2 fingers above this point. Place your hand above your fingers.
Xiphodynia causes localized pain. It can stem from direct trauma like accidents, overuse from intense workouts, or even severe coughing fits.
Inflammation of the xiphosternal joint causes localized costochondritis. GERD and acid reflux mimic this burning pain. Hiatal hernias exert physical pressure. Gastric ulcers radiate pain upward.
Procedures like open-heart surgery can destabilize the xiphoid process. Also, an abnormally long process is prone to friction, leading to chronic nerve irritation.
Xiphodynia is diagnosed by replicating the pain. It differs from a heart attack if pressure worsens it. Doctors must always rule out cardiac emergencies first. Xiphodynia diagnosis focuses on exclusion. We first rule out life-threatening causes. The definitive test is physical palpation.
Yes, that reproduces the pain.
For xiphodynia, we start with conservative care. Avoid heavy lifting or exercises that strain your sternum. Alternating hot and cold packs will help soothe the muscles. If oral medications fail, a doctor can inject a mixture directly into the xiphosternal joint. This temporarily numbs nerve pathways and aggressively knocks down localized inflammation.
Third-line management may involve specific anatomical landmarks. The xiphoid process is the smallest region of the sternum. It is located at the inferior tip.
Chest pain can be terrifying, but is it xiphoid pain is sharp and hurts fiercely when pressed. A heart attack feels like a crushing weight and doesn't change when you move. If pain radiates to your arm or jaw, seek help immediately. Xiphoidectomy removes the xiphoid process. It's a low-risk outpatient procedure. Avoid driving or heavy lifting during recovery. Desk jobs can resume in 2 to 3 weeks. Full recovery takes 8 weeks.
Any surgery involves risks. An incision along the linea alba can weaken the abdominal wall, leading to a hernia. There are also risks of nerve or internal injury.
For chest wall pain, try the doorway stretch. Place your forearms flat with elbows at 90 degrees. Gently step forward until you feel a comfortable stretch. Hold for 30 seconds to reduce tension. Place the roller under your mid-back. Melt your head and upper back backward. Hold for several seconds to relieve strain. Return to flat, move the roller, and repeat. Start on your hands and knees. Inhale, drop your belly and arch your back. Exhale, tuck your chin and round your spine. Repeat 10 to 15 times. Place one hand on your chest and the other on your belly. Inhale deeply through your nose, expanding your stomach. This forces the work, calming frayed nerves. These target inflammation of the xiphus joint, such as prescription-strength naproxen or ibuprofen. COX-2 inhibitors are gentler on the stomach lining. Muscle relaxants help if severe spasms occur. Medical therapy aims to knock down inflammation. Gastrointestinal protectants like PPIs protect the stomach. They guard against strong NSAIDs. Localized injections provide targeted relief. This controls the pain. Slouching puts immense pressure on your chest. It compresses your xiphoid process and ribs. Raise your screen so the top is at eye level. This stops your head from tilting down and collapsing your chest. Support your lumbar curve. Adjust your armrests. Avoid reaching forward. Pull your keyboard close. Keep your wrists straight. Work comfortably. Long-term use of gabapentin can cause chronic dizziness. It may also lead to mood swings and memory issues. Never stop this medication abruptly.
Always consult your doctor to taper off safely.
Watch out for these signs. NSAIDs can damage your stomach. It starts with burning pain, followed by constant nausea, and acid regurgitation.
Flag symptoms of bleeding ulcers. Contact a doctor immediately if you notice dark, tarry stools or vomiting blood, feeling dizzy, faint, or unusually weak, or sudden, sharp, severe abdominal pain.
Long-term use of NSAIDs like ibuprofen can damage your stomach lining, leading to ulcers. They also increase blood pressure and cause chronic kidney damage over time.